This is the 2024 HUD HMIS Data Standard Changes Training Module. To gain credit for attending this whole module, please watch until the very end slide and let the audio completely finish. Otherwise, your attendance may be recorded as incomplete.
In this module, we'll go over the 2024 HUD HMIS data standard changes that will impact HMIS data entry. For the most part, we'll go over changes in order of element number, although some elements we may lump together. You can think of elements as HMIS questions or question sections with corresponding options. The data standards go live October 1st, 2023. HMIS users must complete this training prior to then. Only users that have completed this training will regain their HMIS access, so please watch this training in its entirety to assure you receive credit for completing. Certain funder-specific project changes are in separate modules, as those are only required for HMIS users doing data entry for those projects. Since these changes will go live October 1st, please don't apply them until then. Yes, and the rest of this training won't be as dramatic as that opening.
So, there are a few HUD documents to know about. The HUD HMIS Data Standards Manual. This is your go-to guide for HMIS users and lead system administrators, including rationale, data collection instructions, requirements, and collection points. The HUD HMIS Data Standards Dictionary. This document is intended to support HMIS vendors, leads, and HMIS users in understanding the data element table structures. It's more technical than the Data Standards Manual. There are HMIS Federal Partner Program manuals for certain federal funding sources. This includes, for example, VA, the Department of Veterans Administration, like their SSVF program, PATH, RHY, HUD-VASH, HUD-COC, ESG, and YHDP. That was a lot of acronyms in one mouthful there. Finally, Commerce and our HMIS vendor, BitFocus, will provide updated sample forms and links on our website. Please be sure to also download the resource document from this module's additional resources section. It includes a link to their website and links to all of the manuals and more, including our website. In this section, we'll go over universal data elements. These apply to all projects participating in HMIS. Let's jump into the changes. Many of the data standard changes will impact agency HMIS data collection forms or documentation you have that point out HMIS questions, responses, or definitions. If your agency has custom forms or related materials you created to collect this information, those will need to be updated. We will not be repeating that. Your forms need to be updated on each slide. That'd be redundant. Instead, we'll say form updates on the slide. However, if there are other actions or impacts to be noted, we will mention those. Our HMIS vendor, BitFocus, provides general data collection forms on their website. However, some of their forms have data elements that don't apply to some of our HMIS project screens. We plan to have a link on our Commerce HMIS webpage for forms instead. This will likely be after October 1st, so please be patient with us as we work on updating the forms and web link. Data quality elements are often the last response options from a drop-down field or have their own field dependent to an adjacent field. The response option, Client Refused, has changed to Client Prefers Not to Answer. Most elements in HMIS contain the data quality response options, so This is a significant change, which applies to all data quality fields throughout HMIS. The other options, client doesn't know and data not collected, will remain the same. Impact, form updates. Let's clarify that this change is regarding response options in HMIS and not the term we use to describe a type of client profile. So there is no confusion, we also use the term client refused to reference clients that do not have any personally identifiable information entered into HMIS and the type of profile it is. The term is used to tell the difference between consenting and consent refused clients. This practice will remain the same. 3.01 Name, found on the Client Profile screen. This element's data collection instructions have changed. Before, clients needed to provide their legal name for HMIS entry, and if they didn't, they'd be considered a consent refused client. HMIS records should use a client's full and accurate name whenever possible, and if the client doesn't associate with their legal name, the name entered into HMIS should reflect the name the client identifies with instead. An exception to this is if a legal name is required by the funder for that funding-specific project in HMIS. For example, SSVF is funded by the Department of Veterans Affairs and still requires legal names to verify veteran status. One example of how this change may impact client intake is that now a client may say they prefer a different gender name, as this can be recorded in HMIS instead of a legal name. HMIS still requires that the first and last name field be populated for consenting client records. Also, we still can't enter a partial name into HMIS. And for a consent client only, if there is an alias you'd like to record, such as a street name or nickname, that can still be entered in the alias field. Impacts. Form updates. 3.03 Social Security Number. This is recorded on the client profile screen in HMIS. It's the first field. The data collection instructions have changed for HUD, COC, and ESG projects, as well as PATH-funded projects. Those projects can record a full or only the last 4 digits of a client's Social Security number if the client consents to providing it for HMIS entry. Of course, the client can still choose not to share their Social Security number in HMIS. Please don't replace any consenting 9-digit Social Security numbers recorded in HMIS to be only the last 4 digits unless the client specifically requests this change. Take note, Veteran Affairs funded projects still must collect a full Social Security number. This doesn't mean all veterans must provide it for HMIS data entry. It means only the ones being entered into a VA-funded project. 3.04 Race and Ethnicity. You'll find this on the client profile screen in HMIS. The ethnicity element has been combined with race. We'll show all of the changes in the next couple of slides. For this element, starting October 1st, you'll also want to review the response options with active clients at the next appropriate encounter with them. If they have updates to their profile, you'll make those changes in HMIS as appropriate. And of course, form updates. This table is to help you compare the previously collected responses with the new ones. I won't read all of these, as you can find them all in the HUD HMIS Data Standards Manual. This is here so you can just visually understand that some of the definitions have changed and were expanded. More changes are continued on the next slide. If you like, you can pause and go through what's on the slide. One significant change for the race responses is the addition of Middle Eastern or North African. The ethnicity response, Hispanic, Latina, Latin, Latino, was combined with race and wording slightly changed. Also, some of the other response definitions were expanded, and an additional race and ethnicity response option was added. This allows clients to provide an answer that is not already listed. You will enter their additional response in the corresponding open text field. Clients can still multi-select response options, with the exception of client doesn't know, data not collected, or client prefers not to answer. If the client selects one of those, they obviously wouldn't select the other options. If you'd like, you can pause this to review the slide text. 3.06 Gender. You'll find this one on the client profile screen in HMIS. We'll go over some of the changes in the next slide. For this element, starting October 1st, you'll also want to review the response options with active clients at the next appropriate encounter with them. If they have updated their responses, you'll make those changes in HMIS as appropriate and verify pre-existing responses for accuracy and form updates. This table is to help you compare the previously collected responses with the new ones. I won't read all of these, as you can find them all in the HUD HMIS Data Standards Manual. This is here so you can visually understand that some of the definitions of fields have changed or were expanded. Some of the changes are: female is now woman or girl if a child, male is now man or boy if a child, a gender other than singular female or male, e.g. non-binary, gender fluid, agender, culturally specific gender, has been split into two separate responses. More changes are continued on the next slide. Feel free to pause this so you can review the slide text. A new response was added for different identity with an open text field. If the client wants to add a response not already listed, they can provide additional details here. Multiple responses can be recorded unless the response is client doesn't know, client prefers not to answer, or data not collected. Additional guidance was added for the response questioning, as it's about exploring one's gender identity, versus the response option client doesn't know. Client doesn't know is selected if a client doesn't know their gender from any of the response options available. It's important to remember that answers recorded into HMIS are based on what the client identifies as. Your observations should never be used to answer this. Also, you should never ask for proof of such information. 3.07 Veteran Status and V1 Veterans Information. The definition of veteran was removed from the 2024 HMIS HUD Data Standards Manual. Because the Department of Veterans Affairs maintains this definition, the legal definition of veteran is now found in the Department of Veterans Affairs Data Guide on their HMIS and data reporting site. Both 3.07 and V1 are found on the client profile screen. 3.07 is for veteran status, so you can record if they are a veteran or not. For the HMIS purposes, veteran status should be yes for anyone who has ever been on active duty in the armed forces of the United States, regardless of discharge status or length of service. Due to the complexity of the definitions for active military service and eligibility, please refer to the SSVF VA Data Guide under Element 3.07 Veteran Status for detailed information. If yes is selected to connotate they are a veteran, the dependent response options for a branch of military will appear. Added to this list is Space Force.
Space, the final frontier.
And remember, update any relevant forms. The following are common data elements. In the HUD HMIS Data Standards Manual, the term Common Program-Specific Data Elements is used to indicate elements based on a list of funders. However, in our HMIS, most of the projects collect these elements regardless of funder. Oh, this is a big one. For destination living situation and current living situation elements, we've combined the changes in the following slides. Destination questions are found on the program exit screen. Living situation questions are found on the program enrollment screen. And the current living questions are found under the program assessment screen. This one is primarily collected to record contacts in street outreach projects, regardless of funding source. There are some additional funder requirements that expand the collection of this to non-outreach project types, for example, PATH projects, but some of those were pre-existing. The response options for them all are organized by header based on categories such as homeless situation, temporary situations, and etc. Temporary and permanent situations were separated into their own headers. Selecting a category will reveal the corresponding dependent responses. For example, if you pick the category homeless situation, you will see the response options that fall under that definition, such as place not meant for human habitation or emergency shelter. When I say this, I mean drop-down fields on whatever screen you're working on. Other changes are the dependency for permanent subsidized options were added. For example, rental by client with ongoing housing subsidy is an additional option under this category. Minor wording changes to host home, non-crisis response, and the subsidized destination for rental by client with ongoing housing subsidy was moved to a new dependent field. We'll continue changes on the next slide.
Continued from the last slide. The words "or RHY funded" was removed from the option emergency shelter, including hotel or motel paid for with emergency shelter voucher, host home shelter. Finally, 4.19 coordinated entry assessment and 4.20 coordinated entry event was retired from current living situation.
Fatality.
For a full list of categories and responses that fall under destination, living situation, and current living situation, please check the HUD HMIS Data Standards Manual. Appendix A is very useful for comparing response options. 4.04 Health Insurance. Under the program exit and enrollment screens, not screams, screens. The term Veterans Administration Medical Services field was changed to Veterans Health Administration.
Additional information. A few more things we want you to know. And then soon it'll be over. Trust me.
Additional updates.
Do you ever look at someone and wonder what is going on inside their head?
Well, if you were to look at the list of HMIS data standard changes in the 2024 HUD HMIS Data Standards Manual, you'd get an idea of what was in their head, and you'd notice there's a lot more changes than what was covered in this training module. The rest of those data standard changes do not impact our HMIS data entry, so there's no point in mentioning them here, since we won't need to know. However, there may be funder-specific changes that we'll go over in other modules within this course. Please take any funder-specific modules that apply to the work you do in HMIS. The other modules are HUD COC funded projects, Department of Veteran Affairs funded projects, and youth programs. And yes, I forgot to put my phone on silent, but doesn't that make training all the more interesting?
HMIS account follow-up information. You're probably taking this training because it's mandatory. This means you have an active HMIS account. If you completed this training by October 1st, we will record your completion and you do nothing. your account will be fine. HMIS user accounts will only be deactivated for account holders that do not complete this training by October 1st. For folks that are deactivated, their accounts that is, not them, once they complete this training, we'll start the process of reactivation. That may take up to a week, and we typically process those on Thursdays, the magic day, along with our new user accounts. The exception to what I've said is if you don't or haven't used your HMIS account in 6 or more months, then your account is automatically deactivated per our HMIS policies, and you'd have to retake all of the new user trainings. So yeah, use HMIS regularly, run some reports at least, and check for data quality. So the end is in sight. Let's go to the next slide. Guess what? This is the end of the module. You made it! Now go celebrate, and thank you for your time.